Now we stay with the COVID-19 pandemic. To get some perspective, let's cross over to Shagamu in Ogun State, where Dr. Babatunde Ipaye, a public health specialist and a former commissioner for health, joins us live via Zoom. Dr. Babatunde, I'd like to thank you most kindly for agreeing to speak with Galaxy TV. Now, as a public health specialist, just how worried are you as Nigerians continue to pay little or no attention to the COVID-19 safety measures that has led to the deaths and a surge in infections among health workers and residents?
That we should take the second wave more serious than we did take the first wave. You recall that during the first wave that we had between March and April of last year, there was significant government action that led to the minimization of impact both on the health of Nigerians and the economy of the country. The second wave, which is impacting significantly, in a higher proportion than the first wave in other countries of the world, is also having similar impact in Nigeria. And the expectation is that both the government and the people should act, in the same proportion as the virus is impacting on us.
Well, Doctor, the Nigerian Center for Disease Control, NCDC, says Nigerians will soon have the opportunity of knowing their status within 30 minutes of undergoing COVID-19 tests through the rapid diagnostic test kits, which will be deployed in general and tertiary hospitals. Do you think this development will spur Nigerians to come out for testing?
Yeah, thank you. This will recall that towards the end of last year, WHO gave emergency authorization approval to the use of two rapid test kits, one made by the SD Biosciences of South Korea and another by the Abbott of US. And these test kits have their own significant advantage. For many of us, this is what we have advocated for, since the middle of last year. And now that this has been approved by the Nigeria Center for Disease Control, it is good news. The expectation is that government should support institutions to make sure that this is deployed. I'd like to let you know that I'm aware that NCDC had given approval for the use of this test kit for almost 6 weeks now. This approval must be given concrete action by governments at both the federal and the state level. My expectation is that the federal government should start the deployment of this immediately. The state government should also make this available for citizens, particularly at the community level. The NCDC had approved the use of this, particularly in the health institution for patients that are coming, so that it will protect the health workers significantly and also allow early diagnosis for patients who may be positive. I'm also aware that this has been recommended for use in schools, particularly as we put pressure on the education institution to open. It has also been used for deployment, and I'm aware that it has been deployed in the NYC camps in Nigeria during the last orientation activity that took place. And they have also recommended for the deployment of such in so many places. And today, I'm also, adding my voice to ensure that this is also deployed at the community level, particularly at the primary care level, because within 30 minutes, you are able to detect, significant number of positive patients. Many of these test kits have sensitivity of up to 80%. The implication of that is that they're able to pick 8 out of every 10 positive cases. If we're able to, get 8 out of 10 positive cases, then we're able to contain the, virus as early as possible. People are isolated as early and quickly as possible. And of course, those who are positive are referred for further screening or possible medication. And the good news about this test is that once it says it's negative, it is negative. So for me, the affordability
Just one final question.
and the ease of deployment of that test makes it more ideal for deployment in.
Just a moment, Dr. Babatunde. As Nigeria battles the second wave of the pandemic, the Minister of Information and Culture, Lai Mohammed, says the federal government has no plans whatsoever to impose a fresh lockdown. However, the Presidential Task Force on COVID-19 thinks otherwise. Do you see an imminent lockdown in Nigeria?
Nigeria should have locked down to prevent this second wave that is badly impacting on people. I mean, you need to be in our state to understand what is happening. I see deaths of colleagues every day. I see deaths of individuals that are very important to driving the economy of Nigeria die in droves. I can't start mentioning names, but there are prominent Nigerians that we have lost to COVID-19 in the last couple of weeks, which I'm sure you are aware. And then many more Nigerians are dying, and many people are isolated both in the facilities and in their homes. So, and you can't have that and assume that a miracle will happen. So for me, the NCDC or the PTF will do the technical recommendation to government. I hope that the government will see reasons and do the needful. Of course, you can do some staggered lockdown, or you could do just like we did in the past. You could lock down places where you consider the epicenter of the disease or where transmission is huge, and of course allow some of that economy to run. But to say the government is not going to lock down against the evidence that we have is not a good decision to make.
Dr. Babatunde, we'd like to thank you most kindly for agreeing to speak with Galaxy TV.
Thank you. You're welcome.
We've been speaking with a public health specialist and former commissioner for health in Ogun State, Dr. Babatunde